Hello, everyone. I'm Melissa Budzinski with Gilda's Club Grand Rapids, and today we are bringing you a talk about cancer treatment and COVID-19. And we have with us today a very special guest. She's special to us at Gilda's Club because she's on contract staff with us, and she was also our intern. Isn't that right, Heather?
It is.
So
10 years ago.
Oh my good, really? Wow, time flies. And Heather comes to us today from the Cancer and Hematology Center of West Michigan that is located in the Lemon Holton Center here in Grand Rapids. And she is the director of social work for the center. And she's going to talk with us about that very difficult time about how do I continue my cancer treatments during COVID-19. We've gotten, Heather, lots of questions at the clubhouse, lots of discussion in our virtual groups about this. People are really anxious and concerned. And so I'm just really grateful that you're offering your time and your expertise with us to share with us about how to manage this. How do I do this? So without further ado, I'm going to hand it over to you. One other thing that I did want to say also is that if any of you out there in Facebook land that are watching or later watching the recording have any questions or comments, please make those questions and comments right in the Facebook stream, and then we will get back to you after the talk is done. We also will take emails or phone calls after it's done and help you to try to get connected. So, all right, Heather, well, take it away. Thank you.
Yeah, thanks so much for having me, everyone. I know we've been getting a lot of questions about these types of things as well. Obviously, healthcare is a lot different in this new environment with COVID. And so we understand those questions, and I'm glad to have the opportunity to help address a lot of them. So in terms of coming to our office and what may look different or be the same, a lot of our actual in-office visits you may have noticed or may start to notice are now being done virtually. So it's really important for you to know that if somebody is on active treatment or needs to start treatment, we are not delaying that. It's business as usual. You're still coming into the office, you're getting your treatment, you're seeing your provider. It is absolutely critical and important to us that we can stay on top of that and that we don't have to delay your treatment. For people who aren't on active treatment or are maybe on an oral medication and aren't seen in our offices frequently, a lot of those visits are being done virtually. So we are using a program similar to Zoom where you can see your provider, they can see you, and you're having all of the aspects of conversation you normally would, but it's being done in a virtual format. That's really important to us because reducing the number of patients in our office at one time helps to keep everybody safe. As I'm sure you're aware, a lot of the people who come to us have compromised immune systems as a result of chemotherapy. And for that reason, minimizing the number of people they come into contact with in the waiting room, the hallways, things like that is really important. So that was really the main reason behind our virtual visits. But also just keeping the people who have those virtual visits safe as well. We don't want you making excessive trips outside of your home. It's important that you can stay there and stay safe to whatever extent possible. And we really have had a great response with doing virtual visits. So we've been very pleased and our patients have been very pleased with how that's gone so far. It's been a great service. For those that are coming into the office, there are some additional changes that you're going to notice. When you walk into the building, you are going to be asked to give information about potential COVID symptoms, COVID diagnosis, or exposure to somebody who has COVID-19. That helps us to best screen and keep our patients safe. Patients are also having their temperature typically checked. We use a temporal thermometer that goes across the forehead, and that lets us know what your temperature is. And then we are also handing out masks. So anybody who comes into our office, patient or employee, is wearing a mask. And that again is to keep you safe, keep our staff safe, and help to slow or prevent the spread of COVID. So that's a big change from how it used to be in the past. One of the maybe most challenging aspects for our patients and for our staff with all of this has been the difficult decision to limit visitors. So traditionally, if you were coming in for an appointment or for chemotherapy, you were able to bring your support team with you. So your spouse, your parent, your child, whomever was able to come alongside you. For safety reasons that I've outlined previously with slowing the spread, and in compliance with the governor's directive related to health services and in compliance with our fellow healthcare partners' directives, we had to make the really tough decision to say no visitors allowed right now. There are special exceptions where we do allow that. Maybe if somebody has a guardian or somebody that's needing to make decisions or provide acute care for them, but in most cases, we've had to say no visitors. Please know that that was a really hard decision for us. We didn't take it lightly. We know that it can cause a lot of anxiety and stress for our patients. And while we can't be that person for you, our team is very aware of that. And our nurses, our registration, our physicians, we are here to support you in any way that we can and to offer that support and kind of stand in the gap. So know that it's something that we're reevaluating on truly a weekly basis. And as soon as it's safe to reintroduce visitors to our suite, we'll be doing that. And it's really something that we know is very important. So it's not something that will be delayed when it's safe to do so. The other thing you might notice in terms of accessing care that's different is if you're somebody who gets a yearly mammogram or maybe a CT scan, those things are being delayed just a little bit right now. So while the hospital systems kind of work on essential versus non-essential services or acute versus non-acute, some of those things are being prioritized a little bit differently. If you have any concerns about a scan that's being delayed and how that might impact you, please let your provider know. Please call our office. We're happy to talk with you about that. Certainly anybody who needs a scan emergently or soon is having that done. And we're really looking at those on a case-by-case basis to ensure safety for all of our patients. But that is a change you may notice if you have a scan that's been delayed. In terms of how to be safe, so a lot of our patients ask how they can be safe in our office, outside of our office, what they can do to mitigate their risk. And those are really important questions. Obviously, the CDC and the local and state guidelines related to COVID are in place for our patients as well. So we ask that you follow social distancing, that you're maintaining 6 feet separation from people not in your household if you do need to go out into public. So at the community, it's important to maintain that. If you are on active treatment, if you can designate, somebody else in your household to make those trips to the grocery store or the gas station, that would be very helpful. We understand that's not possible for every person. And so if you do need to get out, maintaining that social distance is important. It's also important that when you are out in the community, you're wearing a mask. So using a cloth mask to protect your nose and mouth is very important in protecting you and also protecting other people and limiting the spread. So following those directions regarding masks is also very helpful. If you've been on treatment, you know that we are always telling you to frequently wash your hands, and that is something that is still the same with COVID-19. So making sure that you are washing your hands frequently, making sure that common touch points in your house, so surfaces that you may be touching a lot, are disinfected with a disinfecting spray frequently. Those are still very applicable, very helpful things to do during COVID-19, and those are things that we still would encourage. The other thing that I wanted to mention, because we've had a lot of question, is there anything I can do to keep myself safe and maybe bolster my health? So is there anything I can do to be more preventative rather than just washing my hands or wearing a glove to kind of boost my immune system? So again, all of the recommendations that we've always given our patients are still true. So we would encourage you to refrain from smoking. We would encourage you to moderately exercise, to eat a healthy diet with lots of fruits and vegetables, to get enough sleep. Those things that have always been important for taking care of our bodies are just as important, if not more important, during this new time of COVID. So all of those recommendations hold true, and those are things we still encourage you to do. Most importantly, just know that this is a continually evolving situation. So we are every week looking at best practice decisions, how to keep our patients safe. We're constantly kind of tweaking and refining our policies and our recommendations. So if you have questions on any of this, know that you are always welcome to reach out to any of your oncologist office. We are here, we are getting lots of those questions. We are happy to answer those questions. We share in your concern, and we really want to support you in any way that we can. So please don't hesitate to let us know as those questions come up, as those concerns come up. Let us know what we can answer for you. We're really all in this together. Thanks so much.
Excellent. Thank you so much, Heather. Wow, what really good information to have about interfacing with the facility and making sure that we're still attending to our treatment and our health. I love the tips of how to just stay healthy too. Really beautiful. I really appreciate that. I would love to also have you extend a big thank you to everyone on your staff and to you and the doctors and the nurses that are working so hard to, and in some instances putting their lives on the line for your patients and our members who continually need treatment and need to see you. And we so appreciate that dedication and that care that you're providing. So thank you so much for doing that.
It's really our honor to do the work that we do all the time, and especially now because we truly, just as a global community, are all in this together. And so our mission here doesn't change, and we're doing everything we can to continue to treat our patients and keep them safe. And so it's really an honor to partner alongside people during their cancer journey.
Yeah. Oh, that's great. And I want you to know that we are here for you, wanting to support you as healthcare workers and a facility who are out there on the front lines, and also anyone else who is watching, that, we truly are in this together. And in our isolation, we'd like to stay connected and continue to have conversations like this very important one. And if you come up with other ideas, things that you want to know about, please let us know. Write that in the comment or send us an email, give us a call. We'd love to present as much great, positive, helpful information as we can. So, so grateful that you gave of your time, and so glad that you're there for our members and for our community.
Absolutely. And as Melissa said, feel free to put any questions in the comments, and we're happy to help answer those. We know there are a lot of questions, and I may not have touched on all of them right now, so we're happy to help share that information and make sure that you're informed.
Great. And we will post your website address and contact information, so that if people want to contact your office directly, that they'll at least have a way to do that. And as always, that at Gilda's Club, we are here 9 to 5 answering phones. We have launched our virtual clubhouse. We have all kinds of offerings of support groups, cancer and grief, as well as seminars like this that are on our Facebook page, and exercise classes. So you could come and meditate with us and exercise, and our ukulele class is up and running. So lots of really just enriching, supportive, healthy options for when you're at home on a virtual platform. So, all right. Well, thank you so much again, Heather, and extend that thank you to your office. And we'll see you all hopefully next Wednesday at 1 when we present a book and craft. So take care.